Some of the complications that are associated with epilepsy initially are usually seen when the child is developing. So we expect at certain ages the child to have acquired some developmental milestones. For example, at 2 months they should have been able to control their necks. At around 6 months, these children should have been able to sit. At around 1 year, these children should be able to walk, or even standing, or just maybe standing using, like when they're supporting themselves. So epilepsy can cause a delay in these milestones. So also we have some children who, on the basis of the normal developmental milestones, they've been able to achieve these milestones. But when they have these seizures frequently, there are times when they can start regressing, to the extent that any milestones that they had achieved, they now start regressing backwards. So it is usually very necessary, like these seizures are controlled as early as possible. We also have school-going children who these seizures can actually affect them in their class. We find that we do have absence seizures, whereby a child can develop absences. They are not able to get any lessons that they are being taught. They have these instances of maybe staring. They have these instances whereby when they start having the actual seizures, their normal lessons or learning are usually interrupted. So epilepsy can also have other complications in terms of maybe during the actual seizures. We usually find patients sustaining injuries, especially whereby they cannot control anything that is happening. So we do experience people who get tongue injuries. Others usually get bites. Others usually get cuts, bruises. So also these seizures can also cause disability when we are having the actual tonic-clonic seizures or jerking of one-sided upper and lower limb. This can be so severe to the extent that it can cause paralysis or disability. So we also get epilepsy whereby one is having seizures that take long, that is probably more than 5 minutes, or when we have frequent seizures whereby we don't get any, like this patient cannot regain consciousness in between the seizures. So this can also lead to permanent brain damage.